The Dix Hallpike Maneuver is designed to detect the presence of benign paroxysmal positional vertigo, often abbreviated as BPPV. This maneuver is contraindicated for any patient who has serious neck pathology, such as acute neck injuries, cervical instability, cervical disc herniation, vertebrobasilar insufficiency, and carotid artery stenosis. To perform the Dix Hallpike maneuver, begin by asking the patient to sit on the examination table with their legs extended. To examine the right ear, rotate the patient's head 45 degrees to the right. While supporting the patient's head, quickly bring them into the supine position and extend their head off the table to about 30 degrees. Ask the patient to look directly at your nose and report if they experience any vertigo. Observe the patient's eyes for at least 30 seconds for any signs of nystagmus. If present, there is usually a latency period of 5 to 10 seconds before it begins. If in this position you observe nystagmus and the patient begins to experience vertigo, the Dix Hallpike maneuver is considered positive for the right side. Wait for the nystagmus and vertigo to stop, and then assist the patient back to the starting position. If there was no nystagmus while testing the right side, repeat the maneuver for the left side. Typically, patients with posterior canal BPPV will demonstrate nystagmus on only one side. Approximately 90% of BPPV cases involve the posterior semicircular canal. In posterior canal BPPV, the patient demonstrates upbeat vertical nystagmus, which has a rotational component, with the upper poles of the eyes beating towards the ground. The nystagmus usually lasts for 10 to 30 seconds, but may persist for up to 60 seconds. To treat posterior canal BPPV, a procedure called the Epley maneuver can be performed. The Epley maneuver is presented in another video. When BPPV involves the anterior canal, the patient demonstrates downbeat vertical nystagmus, which has a rotational component with the upper poles of the eyes beating towards the ceiling. When BPPV involves the horizontal canal, the patient demonstrates horizontal nystagmus. When horizontal canal involvement is suspected, the head roll test is indicated. The head roll test is presented in another video.